We're streaming live globally from now. We welcome you, and we particularly welcome people who are dialing in from all over the world. So let me explain who I am. I am Professor Beverly Hunt. I'm the founder and also medical director of Lifeblood, the thrombosis charity that's leading today in putting on this conference. And sharing in the leading is...
I'm David Fitzmaurice. I'm an academic GP, which is probably an oxymoron, from Birmingham. And I'm here representing anticoagulation in practice. I'm the past chairman of that organisation and also the National Centre for Anticoagulation Training.
And we're also supported today by the British Society of Haemostasis and Thrombosis, and we have their president somewhere in the audience, Dr. Henry Watson. So, why are we here? What is World Thrombosis Day all about? Can I have the first slide? Thank you. So this really is an unprecedented, fresh start to try and encourage awareness of thrombosis as an issue globally. And the aim of the World Thrombosis Day steering group is to try and engage with organizations, patient groups, and health professionals worldwide so that we can increase awareness of thrombosis. And we have to date more than 175 organizations signed up. Meetings such as this are taking place all over the world, and there are press conferences through the day in different countries. And this has been led by the International Society for Thrombosis and Haemostasis. So what are specific aims today? Well, World Thrombosis Day is focusing on the fact that thrombosis is a major cause of death, and we're going to hear from Lord Professor Kakar later about the global burden of thrombosis, but we're specifically focusing on venous thromboembolism, deep vein thrombosis, and pulmonary embolism. And we're focusing on 4 objectives today. We really want to reduce the number of undiagnosed and misdiagnosed cases. And we warmly welcome many patients here today. We're going to hear some of their stories, and you'll hear that misdiagnosis is a major issue in venous thromboembolism. We also want to increase the implementation of evidence-based prevention, particularly in hospitals, which is the major cause of blood clots. And we want to encourage healthcare systems to implement strategies to ensure they use best practice. And lastly, we want to encourage people to donate money so that we can improve research and best practice in these areas. And so we've picked today because it's a very special day. It's the birthday of really the father of thrombosis, who was Rudolf Virchow. He used to work in Berlin. He was the one that coined the term thrombosis, pulmonary embolism, and he did describe the 3 important things that cause venous thrombosis, which is stasis, sticky blood, and changes in the vessel wall. And we're going to hear later from Dr. Anders Cohen about venous thromboembolism. David, do you want to just walk us through the day?
Thank you very much. So, as Beverly's started to tell you, we're going to start with looking at what the burden of thrombosis is globally, looking at also the burden of venous thromboembolism. And then what I think is probably the most important part of today is hearing the patient stories. So we've got 2 patients who are going to tell us their experience of living and experiencing thrombosis, which I think is always very humbling, but also gives us great insight into what the real issues are. At lunchtime, we've got various games in terms of putting stockings on, and Beverly can also tell you about if you want to take a picture of your leg and give her £1, she'll put a picture of your leg on the Lifeblood website.
Something like that, yes.
We'll also be hearing about the new agents which are available to replace warfarin now. So I think the things have really moved in the last 5 years in terms of both prevention and potential treatments. And then finally, a little symposium towards the end of the day around post-thrombotic syndrome, which we were just discussing prior to starting, is a much under-researched area, but is absolutely devastating for patients when they get severe post-thrombotic syndrome. So that's the flavour of the day. We do want it to be interactive. We want plenty of questions, and I would imagine Beverly's going to be quite provocative in her questions, because it says on here we've got to have a call to arms, so that will be interesting to see.